Hello everyone. Today, we're diving into the world of a medication called hydroxyurea, commonly known by its brand name, Hydrea. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Hydroxyurea, often recognized by its brand name Hydrea, is an oral medication that falls under the category of antineoplastic agents. It works by inhibiting the synthesis of DNA, which is crucial for the growth and division of cancer cells. Initially approved by the FDA in 1967, it's primarily prescribed for certain types of cancer, such as chronic myeloid leukemia, CML, and squamous cell carcinomas of the head and neck. Additionally, it plays a significant role in treating sickle cell anemia by increasing the production of fetal hemoglobin, which helps reduce the frequency of painful crises and the need for blood transfusions. Warnings: Hydroxyurea comes with its set of precautions. It's not intended for use during pregnancy due to the potential risk of harm to the unborn baby. Women of childbearing potential should use effective contraception while taking this medication. Furthermore, hydroxyurea can decrease the bone marrow's ability to produce blood cells, which may lead to conditions like anemia, leukopenia, and thrombocytopenia. Regular blood tests are essential to monitor blood cell counts and ensure the medication is working safely. Before taking this medicine. Before starting hydroxyurea, several factors need consideration. It's essential to inform your healthcare provider if you have allergies to the drug or any other medications. Given its impact on blood cells, those with bone marrow problems should discuss potential risks and benefits with their doctor. If you have a history of kidney or liver disease, it's crucial to consult with your healthcare provider. Regular monitoring of blood cell counts is advised to manage potential side effects effectively. You should not take hydroxyurea if you are pregnant or planning to become pregnant, as it can harm the unborn baby. It's also not recommended for those who have severe bone marrow suppression or are receiving long-term treatment with this medication without regular blood monitoring. If you have a history of skin cancer, inform your doctor, as hydroxyurea can increase the risk of developing secondary malignancies. Before starting the medication, inform your doctor if you have ever had HIV or AIDS, high levels of uric acid in your blood, gout, or if you are taking medications to prevent blood clots. It's also essential to let your healthcare provider know if you have any infections, as hydroxyurea can lower your body's ability to fight infections. Side effects: All medications can have side effects, and hydroxyurea is no exception. Some individuals might experience gastrointestinal symptoms such as nausea, vomiting, or diarrhea. There's also a potential for loss of appetite and weight loss. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Additionally, hydroxyurea can cause serious side effects, including severe bone marrow suppression leading to anemia, leukopenia, and thrombocytopenia. Symptoms can include unusual bleeding or bruising, fatigue, and frequent infections. If you notice any signs of bone marrow suppression, such as fever, sore throat, or unusual bleeding, seek medical attention immediately. Another potential side effect is skin changes, such as darkening of the skin or nails, and the development of painful leg ulcers. Long-term use of hydroxyurea can increase the risk of developing secondary cancers, particularly skin cancer. Furthermore, hydroxyurea may cause serious side effects including liver toxicity, which can manifest as jaundice, yellowing of the skin or eyes, and kidney toxicity, which can cause changes in urine output. It's also important to note that hydroxyurea can increase uric acid levels in the blood, potentially leading to gout or worsening existing gout. Always consult your doctor for medical advice about side effects and report any new or unusual symptoms. Interactions: Hydroxyurea might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. In particular, medications that can affect bone marrow function, such as other chemotherapy agents, should be used with caution. Dosage: Correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking hydroxyurea. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The dosage of hydroxyurea varies depending on the condition being treated. For cancer treatment, the typical starting dose is 20 to 30 mg/kg per day, administered as a single dose. For sickle cell anemia, the usual starting dose is 15 mg per kilogram per day. Your doctor will adjust the dose based on your response to the medication and blood test results. It's important to take hydroxyurea exactly as prescribed and never alter your dosage without consulting your healthcare provider. Avoid. While on hydroxyurea, it's advisable to avoid exposure to infections due to the increased risk of bone marrow suppression. Given the potential for dizziness, it's wise to avoid activities that require full alertness until you know how the medication affects you. As with many medications, it's recommended to avoid alcohol, as it can exacerbate certain side effects. FAQ. Many wonder about the age restrictions for hydroxyurea. Its safety and effectiveness in individuals younger than 18 for cancer treatment are not well established, though it's commonly used in children with sickle cell anemia under medical supervision. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of hydroxyurea. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.